there is most definitely a crisis at hand with elder care in America.
You have shortage of physicians taking care of the elderly. You have shortage of nurses. You have shortage of CNAs, direct caregivers.
This is a multifaceted kind of problem. On the one hand, you've got trouble in many cases, particularly in parts of rural America, finding anyone that's in a position to do this work, particularly to go into someone's home and provide the kind of care and supports that they are needing.
It's really getting folks interested enough to participate in the training, as well as the trainers being trained well enough. Formally, a lot of folks go into working with older adults and it's based on experience alone. There's no formal training.
There's a deficit at all levels, physician levels, nursing levels, social work, etc. We do not provide the necessary support that we need to support the older adults.
There's a lot of aging population, and we're supposed to know how to care for these people, to give them the best care that we can give them.
There's no doubt either we need more faculty members as geriatricians, or in what I think would be a more effective way is to train everyone a little bit in geriatrics so they're proficient in it.
Society has changed. Children are working, they're not able to take care of their parents like they used to.
In order to meet the challenge of this aging revolution, we are going to have to increase our pipeline of trainees at every level.
Geriatrics is team care, so I think that's really the greatest model of care. When you're dealing with somebody who's older and somebody who's maybe seriously ill, they not only have physical needs, they have emotional needs, they have psychosocial needs, they have financial needs, spiritual needs, practical needs, like who's going to bathe them and who's going to transport them. So no one discipline is going to be an expert on all of those issues.
Having been a family caregiver for my grandmother, being able to tie in like an interdisciplinary team is key to having the best care for that loved one. No matter what role I'm playing, make sure that we have other people in place that know the resources, they know what's available, they have the actual education and background so that you can communicate with each other.
We need to definitely, number one, increase the geriatric workforce, number two, educate them properly, and number three, make them culturally and ethnically sensitive to the needs of the elderly people.
In 2011, we will have, I think, over 75 million people approaching 65 or older. By 2030, 1 in 4 will be 65 or older at the current rate of growth in our country. 75% of everyone in America that's 65 or older has at least one chronic health condition. They have to be taken care of. Our staffing is not growing at a rate right now to meet that need because we don't have the funding for the education and we don't have the funding to provide the recognition that they deserve.
The funding that we really need now is to be able to educate more people on how to best care for these older adults in their home or whatever setting they chose.
$1 spent on training a direct care worker to care for an elder makes back far more than $1. We can save thousands of dollars. You know, an admission to an intensive care unit can easily run $10,000 to $50,000 a day, whereas, you know, $50, $100 to help someone stay in their home. You do the math.
What Congress can do is now provide the appropriate appropriations to fund more centers for geriatric education so that we can then train the entire medical community on how to care for senior patients.
We've all known for decades that an older person getting services from their doctor and the doctor doesn't communicate with the mental health person who doesn't communicate with the social worker, it just results in confused, really poor healthcare outcomes, and that the best way to treat illnesses in older populations is to work as a team.
One of the reasons I'm so supportive of the Eldercare Workforce Alliance is that they get it. They know what the message is, and the message is it takes a team of people to care for mom or dad.
And it brings together a lot of organizations that normally would not maybe be working together in fighting and responding to that IOM report about how we are going to deal with this workforce shortage.
What I would really like to see is a community that embraces elder care and allows them to age at home with the support that they need, with the care that they need by people who know how to care for them and want to care for them.